For Orishaba Docus, not her real names, living positively for 14 years now has come with hard-to-explain challenges. Docus first learned of her status in 2009 after suffering endless illnesses. Life then spiraled out of control for the girl who had a vision for her family.
Aherize kungambra na hurrahi na bere nshitami nashwe kwankamizi gakufuka na homani atekateka omufamire ombantu ababurijo naza kurebwanta.
Alone and frightened, Docus first developed self-stigma as she feared to tell her parents of the disease she had been diagnosed with. She says on the fateful day, upon reaching home, she called all family members for a meeting during which she disclosed her HIV status. The revelation was shocking to everyone.
Buri omwe yareba ko buri omwe buri omwe enchi akakoko kasirimu omukeyitwa akakoko kasirimu nokagamba orwire oboshibu bworwire ngu tukwatereho nobo kiri omuntu.
By this time, she had started developing severe HIV and AIDS signs and symptoms. Denying her transport, Docus later managed to walk to Tasso Mbara Center, where she was immediately enrolled on medication. While these drugs require a balanced diet, at home she was being denied food and sometimes she would be locked up in the house to bar her from being in the public. As the situation worsened at home, Docus decided to cry out to one of her cousin brothers who lived in Mbarara City at the time for rescue. At that moment, Docus had developed complications with her pancreas and needed to be operated on. Fortunately, her brother then offered to take her to Mulago Hospital in Kampala, where she was indeed operated on. But as she explains, she is overwhelmed with emotions. As she was steadily healing from the wounds, her rescuer left for greener pastures abroad. This sparked off fresh trauma and stigma that almost led her to committing suicide. Her cousin brother, before leaving, left a rented house in Mbarara City, where she is currently staying. While Docus now manages to access her drugs and frequent counseling, she has no food. She has tried looking for jobs, but majority continue to deny her opportunities upon revealing her HIV status. Docus says she doesn't regret running away from home in Kanyarieru, Kiruhura district. She says the decision saved her life. Psychologists describe stigma and discrimination as poison.
Stigma and discrimination, it's like self-poison. Yes, because you're taking it in. More particular, stigma comes from two fronts. There is that which comes from within you. You're self-stigmatizing. You feel you are not good enough. You know it shouldn't be you.
HIV stigma and discrimination affects the emotional well-being and mental health for the people living with HIV. Patients often internalize the stigma they experience and immediately start developing negative self-image.
Also, people fear to test because they know when the results come out, information will be given about them. Now, if people don't test, they will not access treatment. If they don't access treatment, they not give a healthy life, and two, transmission will continue. So all that is caused because of stigma.
As the country marks the World AIDS Day in Rakai district, the public has been asked to stop stigmatizing and discriminating against people living with HIV in a bid to end the spread of the virus.
The number of people who are already tested and told they're HIV positive, they decide not to come for the free, effective, easy to take HIV treatment that we have in the country now. The reason, they are shy, they are scared of being shamed, of people discovering they're HIV positive. So if we don't end stigma, it means that the HIV treatment models and the HIV prevention tools that we have, which use ARV drugs, they will not be embraced. We know very well that people who are taking the HIV treatment well no longer transmit HIV. So I call upon the community members. If we end stigma, that means all our brothers and sisters who are HIV positive will come freely for treatment. And if they are taking their treatment well, as prescribed by the doctor, the good news is that they will not